Hello, my name is Ash Acharya. I am consultant orthopedic surgeon. I specialize in treatment of hip and knee condition as well as sports knee injuries. Today I would like to talk to you about hip arthritis, its investigations and management. Usually arthritis is the end stage of wear and tear in a joint. How does one present with hip arthritis? Usually the patient has pain and stiffness in the hip. Pain is usually in the groin area, around the side of the hip, near the pocket area, and sometimes the patient may get pain in the buttock. Quite often, the pain is felt in the front of the thigh as far as the knee. Occasionally, patient may present with knee pain and the X-ray of the knee might be normal, but it might be the hip arthritis that is causing the symptom. How does one diagnose hip arthritis? In the clinic, I will take a detailed history and examine the hip and put the hip through range of movement. Usually, the hip movements are quite restricted. Quite often, the patient may feel that the hip is quite stiff, they can't reach their toes, shoes and socks. Usually, the walking distance has become diminished over a period of time. Sometimes patient can have pain at night. In terms of investigations, plain simple radiograph is all that is needed to diagnose hip arthritis. What are the treatment options for hip arthritis? One can start with simple painkillers and anti-inflammatory drugs. If that doesn't seem to relieve the pain, one can try walking aids such as a stick or a crutch. If pain is bad enough, if it affects the quality of life, if it stops you from doing day-to-day chores, and if the X-ray confirms arthritis, one can consider further treatment options. Some patients can try one-off steroid injection in the hip joint. It can relieve the pain for a temporary period of time. Steroid injection has its risk, it has its complications, and it may not be suitable in all cases. If arthritis is quite severe on X-ray, then it might be better to consider joint replacement surgery. Average age of patients undergoing joint replacement in UK is over 60. That doesn't mean we can't do operation in patients younger than 60. In select patients, it can be done. Hip replacement is a big operation. It is a big undertaking, but it is one of the best operations to be had. It is the best operation to improve quality of life. It is usually performed with spinal anesthesia, that is needle in the back, and then the patient can have light sedation. Once we change the hip joint, most of the pain will go away. There is a very small risk of infection, bleeding, clot in the leg. There is a very small risk of one leg being longer than the other. The hip can dislocate, so you have some precautions to follow, and we will go through these. There is a very small risk of fracture and very small risk of damage to nerve or vessel causing foot drop. Most of the hip replacement operations in UK are performed through what is called as posterior approach. So we split the muscle at the back of the hip. Hip replacement can be done using a cement or not using a cement, and we will carefully choose the right option for individual patient depending on the bone quality, the support that is available for the hip implant to go in and stay put. We can discuss this during the consultation. Most of the implants that we use are 10A ODEP rated, which means they have very long lasting track record and they have been in market for more than 10 to 15 years, if not longer. No matter which implant we choose, it will be the best for you and will give you long lasting pain relief.